Good evening, everybody. Thank you for attending with us this evening to talk about an important subject. Maybe all of you have some inquiries or questions in their mind, and which is the present thing in our time now with the COVID vaccine for the children. So, shall I start, or we will wait for more attendees?
Currently, ma'am, we have 125 attendees now. So,
So
I,
we can
as we go on, I think we will have more. So we can proceed, ma'am.
proceed.
Yes.
So today I will talk about the COVID vaccine in children. I hope we will give you the correct and the enough information about this subject, and also at the same time we will answer all your questions and inquiries. So I make my title: Should I give my child the COVID vaccine? Here we will see two pictures, one for Emirati child that is receiving the COVID vaccine, and the other picture is for our beautiful city, Abu Dhabi, which is considered of the safest cities in the world. So our role, we are living in this city, is to keep this city safe and keep safe environment to all the families and the people living in this city. And also, so and as part of this one, we should participate in the COVID vaccine for us and for our children. So before starting talking about the COVID vaccine, we will give just a brief informations about the COVID, but more becomes known now about the coronavirus, especially after these 2 years we are living in this situation. So most of you, they have more informations about this coronavirus and how it's transmitted. So I will give you just a brief talk about it, or a reminder of the COVID-19. COVID-19, it is a disease caused by a type of coronavirus called SARS-CoV-2. So it is a respiratory virus, so transmitted by a respiratory droplets. Respiratory droplets mean someone coughing, sneezing, and also the contact with the contaminated surfaces, contaminated by the droplets from the infected person, hands touching the surface, then touching the eyes or the mouth. So the spread is similar to the seasonal influenza and other respiratory viruses. This coronavirus, as we saw, it was very contagious and it still continued to spread. And this also now noticed particularly in the areas with the low rates of the community COVID-19 vaccination. Children, like the adults, children and toddler, they can get the COVID-19 infection, and also they can spread the infection to other members of the family or to the community. Regarding the symptoms of the COVID of the COVID infection, generally in the children, they will have milder symptoms than the adults. And this is most of the cases that we saw. And even some infected children, they may not have any signs of being sick or any symptoms. Sometimes when the families all have, one family have COVID infection, we will see the child, he's playing nothing, no symptoms, but while during the PCR, because they are in contact with their parents, we will see the PCR will be positive. And in the majority of the cases, it will be mild symptoms. But also still there is a few cases that they have severe symptoms of COVID infection. Generally for the symptoms in the children, we noticed more, it is the cough, fever or the chills, but fever mostly also it was low grade fever that will last 1 or 2 days. Also they will have, we notice they have diarrhea or vomiting, which is more common in children than in the adults. In addition to the other symptoms like sore throat, in the older children they will have body pain, muscle pain, also congestion and the runny nose. So the children infected with the coronavirus, as we say, they have mild symptoms, but few percentage they developed complications also that required hospitalizations. They will have a serious lung infection and become very sick with COVID-19. Especially the children, they have a special medical problem or any other issue with the immune system. Also, in a few cases, we noticed that the children infected with coronavirus, some sometimes they will develop complications, which maybe not be directly after the infection or during the infection period with coronavirus, that can be developed up to 2 months after the COVID infection. Yeah, the child will recover initially from the corona infection, that it was mild symptoms. Then later, after 6 or 8 weeks, he will come to us with severe infection or a severe complication affecting many systems in the body, affecting the lungs, affecting the heart also. But fortunately, also after treatment and the care in the hospital, all of those children recovered from this complication. But my point is still the children, even they have mild symptoms or it is a mild infection, still there is possibility they will have a serious complication. So this is why it is important that we will use the precaution, and it's important to prevent the infection in the children as well as the adults. So how we will keep our children safe? It will be the same precautions that we are using since the start of this COVID era. Our aim is to minimize the spread of this COVID infection to the community, especially, all the basic hand hygiene, using hand sanitizer, the soap and water, teaching our children how doing the cough etiquette, like coughing into the elbow or the tissue. Also, we have to keep our children at home. If we feel they are sick or unwell, we will not send them to the hospitals or to the nurseries. Wearing the face masks, and now the vaccination is playing now an important role in preventing the spread of the COVID-19 infection. So now we all, as an adult, most of us, we took the COVID vaccine. But now many parents also are asking if my child has mild symptoms or if it is not affecting the infection, why should I consider getting him the vaccine? He will develop the normal immunity and it will be finished. So the answers to this question, that first of all, the vaccine will have benefit for your child and also benefit for the community and the environment that we are living. First, the benefits for the child, it will help prevent the kids from getting the infection. So it will decrease the chance that your child get the infection and spread the COVID infection. Because already, and all the children, even if they will have the virus, maybe they will not have symptoms or they will recover quickly. But we have the risk of spreading the COVID infection to other family members. For example, his grandparents living with him also in the house, they have decreased immunity, especially the senior people above 60 of age, or they have medical problems, diabetes, hypertension. The child can spread this COVID infection to your lovely grandparents and then affecting them. The other benefit also, it will prevent your child from becoming severely ill or having this short-term or the long-term complications that I just spoke about, affecting them many systems in the body, especially the children, as we say, that they have medical problems like diabetes, the asthmatic patient, even the obesity. The obesity considered a risk factor in decreasing the immunity of the children. So even if they got the infection and they are vaccinated, it will be mild symptoms, and the vaccine proved to prevent the complications, and also it decreased the admissions to the hospitals, and also decrease the mortality and the death rate. The other benefit, it will, for me, it is also, this is very important point, an important benefit for giving your child the vaccine, is that you can send him to school safely, and also he can do his social life, playing dates, participating in sports and with other group activities and with his friends, online studying, sitting at home. All this period affect the personality, affect the psychological effects of the children. They are become more attached to the computers and to their iPads and laptops. They are isolated, from the outside world, and this is a very bad thing for our growing children and for their brain development and their personality development. Actually, we noticed many of the children coming to us to the clinic after this quarantine, a long time sitting at home. They are suffering from these issues. They have headache. sick, they have change in personality, they become more aggressive. Also, the small children, one time, one parents, they told me that their daughter, she stopped even talking to them, So I think this is a very important benefit of the vaccine, that you will become assure your child going safe to the school and living his normal life, whatever the period will be for the COVID infection. Regarding the COVID vaccine benefits for the community, it will help to protect the community, because sure, we will stop the spread of the infection. And also it will, there's another benefit nowadays, they are talking about that it stop other variants of the virus from emerging. We see from time to time the new variant came, but still when this new variant came, it has also mild symptoms, because most of the people now they are vaccinated. So they have only mild infection. We are not seeing the same complications and the same rate of admissions to the hospitals and the same mortality like before, and like from the start of the COVID era. So now we will talk about the COVID vaccine for children in UAE. COVID vaccine is approved for the children. Actually, it's in most of the countries in the world, but now today I will concentrate in United Arab Emirates. Actually, in May 2021, this was the start. Ministry of the Health and Prevention, they approved the emergency use of Pfizer vaccine for the children between the age of 12 and 15. And this is sure after clinical trials and the strict assessment and the evaluation for the vaccine. Then in June, the Ministry of Health, they started administering to the China Sinopharm vaccine to the children from age 3 to 17 years. Actually, they were volunteers of children. They participate in this clinical trial, and they were followed for about 2 months by the Ministry of the Health, and there was a clinical evaluation for their situation, and fortunately and luckily there was no safety concern were reported. All of those children, they developed antibodies against the COVID infection, and no serious complications, and I think even no mild complications was reported in these volunteers. And according to this, in August 2, 2021, the Ministry of Health, Mohab, its Ministry of Health, announced the provision of the Sinopharm vaccine for the age group starting from 3 years old till 17 years of old. And the last update was in November 2021, it approved the emergency use of Pfizer vaccine also for the children between the age of 5 and 11 years. So we have now 2 types of vaccines available for the children. And in UAE, and now specifically in Emirat Abu Dhabi, from the age 3 through the age of 11, you have the Sinopharm China vaccine that we can provide to the child. From age 12 and older, you can have the choice of giving either Sinopharm or the Pfizer BioNTech vaccine. Both vaccines, they are offered free for charge to all UAE nationals and residents. So the Sinopharm available, and both vaccines actually, it is available via walk-in. There is no need to take an appointment. You can go in all centers of Saha and Mubadala, and also in the Majlis centers and Majlis in Mushrif and Al Batin and many areas in Abu Dhabi. You can find it on the website of Saha. There is all the centers for giving the vaccine to the children. You can go walk in, no appointment, free of charge, and of course every child will go there, will be first evaluated by the doctor to check, he will examine him and check his history if he have any risk factor or any condition that prevents him from taking the vaccine. So I will give you a brief point about what is the Sinopharm and Pfizer vaccine. About the efficacy of the Sinopharm and Pfizer, both they are effective in preventing and decreasing the infection and developing the severe symptoms of COVID-19. And this is especially after completing of 2 doses of the vaccine. You will have to take the first dose, and after 3 weeks you will take the second dose. The full immunity will be developed about 2 weeks or 3 weeks after finishing finishing the 2 doses of the vaccine. These vaccines will stimulate the immune system of the body to make antibodies, and also they prove to be effective in preventing hospitalization and the death from COVID-19. It reached up to 80% in Sinopharm vaccine and even to 90% in Pfizer vaccine. What about the side effects? All maybe you are concerned about maybe my child will have side effects of COVID vaccine. Actually, after the trials that Ministry of Health they did to the volunteers, as I said, no serious side effects reported to any of those children. The vaccine side effect, it will be like any other vaccine giving, especially like the side effects encountered in the childhood. The normal childhood immunization that we are giving to the children, they will have maybe pain or some swelling in the injection site. They will have maybe low-grade fever, and in older children they will feel some achy muscles or body pain. And in rare cases, maybe they will have allergic reaction, but till now we didn't notice any allergic reaction from COVID vaccine. These side effects, actually, it will be temporarily. It will last for 1 or 2 days, and it doesn't need any intervention. Just maybe we'll give him analgesia. And as I said, it is a common side effect like other vaccines that we are giving. There is certain children that they cannot take the vaccine if they have now experiencing and in the present time when they want to take the vaccine, they have an active COVID infection, they cannot take the vaccine. They should recover from this infection. So still the children who previously infected with COVID infection, they can take the vaccine if they have mild symptoms. Once the symptoms will be relieved, they can take the infection, the vaccine, except the children that who experiencing a severe COVID infection and they need hospitalization and special treatment in the hospitals. They have to wait for 3 months, and then they will be evaluated by the doctor. If they are fit, they can also take the vaccine. The other group of the children, also any child who have before any severe allergic reaction to any vaccine, also we will not give him the vaccine. Also, both of these vaccines, they are killed vaccine. They are not live vaccines. For the Sinopharm, it is a killed vaccine, and for the Pfizer vaccine, it's containing a small piece of the virus, which is called mRNA. And these both, the killed vaccine and this small piece, they will just stimulate the immune system of the body, and after that, it will be eliminated of the body. So both vaccines, they don't contain any live virus. So there is maybe too much talk or rumors. Maybe you noticed in the social media like this. I'm talking about the vaccines or maybe side effects, and but they have no proof of truth, for this one. So maybe they will say don't give it to your child because it will give you the infection. So the vaccine will not give your child the infection because, as I said, it does not contain any live virus. Also, there was talk about maybe it will cause infertility in the future. All the studies and the trials done, there was no evidence about causing infertility for the children later on. Also, we heard some talk about maybe the virus will change our DNA like this. Also, this is not true because this vaccine never enter inside the nucleus of our cells where the DNA is already there. Also, there are some talks about it contain GPS or tracking material. All this is just talk on the social medias by people not knowing anything about the vaccine. And the final point also, this is your decision. No one will force you to take the vaccine. It is your decision to decide to take you or your child. So my home message, kids and the families, all we can reduce the coronavirus together. So better to get all your shots. You ensure that all the family members receive the COVID-19 vaccination as soon as they are eligible. And also we will go to other vaccines, the other seasonal vaccines, the flu shots and the normal vaccination for the children. And also, you should know what is the signs and symptoms of the COVID infection and the serious symptoms. Also, you have to be aware of this one so that you will not send your child to the school. When you will know if he is becoming more sick, to bring him to the hospitals. We have to keep teach our children also about the precautionary measures, because also still, if they took the vaccine, as we all the adults, we took the vaccine, but we still have to take care about these precautions. We have to cough and sneeze with care. We keep our hands off the faces, washing, sanitization, wearing the face mask. Although if we will take the vaccine, I will not throw the face mask. Also, I should continue to wear it. The other thing on the last point, and we have to address the anxiety and the stress. So the children will look to you when deciding how to feel about the COVID-19. If you feel calm and prepared, they are likely also to feel similarly, and they will understand their important role also in fighting and preventing this infection and stop its spread in the community. Thank you, and I am ready for all your questions if you have.
All right. Thank you so much, Dr. Rasha, for having this webinar with us. The information you have presented with us is really helpful, especially the misconceptions, the conspiracies that we are seeing online that made some parents very
Hesitate to take the
yes,
vaccine.
hesitating to take the vaccine. So
Actually, this is the aim of this lecture. You know, they can Google and find all of the informations about the vaccine, but I want to give the what is true and what is false, so that they can
exactly, Doc. So we are so lucky to have the information coming
take.
from the specialist and having it delivered especially for our school and from the Ahalia hospital team as well. Now, ma'am, we have two questions here
Yes.
posted by the parents. First question, ma'am, is will there be two vaccination and booster shots needed as well for children? Though that's the first question, ma'am.
Yes, regarding the two doses, each vaccine they should take the two doses, like the adults. They will take first dose after 3 weeks. They will take the second dose. This is for both the Sinopharm and the Pfizer vaccine. Regarding the booster shot, now we will follow what will come. The instructions coming from the Ministry of Health. Now, because the vaccination for the children start later than the adults, it just started in August. So till now, they didn't finish the 6 month after the second dose. At that time, of course, there will be instructions from Ministry of Health to give or whether not to give the booster dose. And also, I think it will depend on the situation at that time, the cases reported like this. But now for us, and as an adult, no, we should take the booster dose after 6 months from finishing the second dose. But as I told you, because the children, most of them starting in August and September, so it is early to talk about this one.
Yes, ma'am. Thank you so much for that. So I hope this question clears to our dear parent and for everyone as well, even for us as a school. And the second and last question, ma'am, posted is how much percentage of parents have accepted or opted for having their child vaccinated? I think this they refer to Abu Dhabi. I think just they want to
Yeah.
know
Actually,
the
I don't have any enough data, because this data it will be collected from all center vaccination centers in Abu Dhabi. But I think I saw coming to our hospital many of the parents. When I'm asking them, they said yes, we give our children this vaccination. But the exact percentage, I don't have information about this one.
okay, though. So I think they just want to get confidence out. Anyway, thank you. That's our
Many
last.
children, actually, many parents, they were very excited to give their children, and especially after they give their vaccine, they notice safe, no side effects, nothing, and I felt they are more comfortable. You know that they are saying, "Khalas, doctor, we send our children now to the school. We are comfortable. Already he took the vaccine. He came with fever. I want to do for him PCR for the COVID." He said, "No, doctor, he took already the vaccine. So that even the child, he will be more comfortable
He has
to
the
go to school.
confidence already.
He said, I have the vaccine, I am vaccinated, it's as a
Yes,
strong point. And they will be also excited, as they are doing their roles in the community. This is very important thing, if you make the child feel that he is part of the community and doing something good, of course, for his benefit first and the community first.
the community first.
Secondly.
Thank you so much, Doc. And I really like the one you mentioned in which the way the students will develop their confidence depends on how the parents will
Sure.
actually
This is
show
the most
that
important.
confidence
If
as
the parents are confident and if they are also vaccinated, if they are encouraged them and they are not listening to the other talks and become, weak and afraid from doing these things, the child will be affected because the parent is his, the ideal person, So when
yes.
they are seeing them, they are comfortable and they have the good decision, they will be also like them.
Okay. All right. Exactly, Doc. Thank you so much, Doc. That's our last question. And Doc, if in case there will be some questions, would it be fine if we can send it via email
Sure,
as well?
sure. Send for
So that
email. Also, we are in our clinics, pediatric clinics in Ahalia Hospital. We are ready to accept all the parents who still have any inquiries or anything, or you want more ideas. We will explain to them also there.
all right, Doc. So
And I have a very nice time to be with you, and inshallah they benefit from our talk today.
yes, yes, Doc.
Thank
They
you.
are very thankful.
Thank you for
In
your
behalf
time.
of International Indian School, with our school leaders, teachers, parents, and our dear students. We are really blessed to have this talk with you. We have a specialist to have this webinar, clear all the misconceptions and conspiracies that they have. And I hope this uh, webinar gives more confidence to our dear parents and would be able to encourage them to have their child vaccinated as well. So thank you so much, Dr. Rasha, and to the entire
Thank
Ahalia
you.
Hospital team for having this webinar with us.
Thank you for your time. Thank you.
Thank you so much, Dr. Rasha.
Thank you.